Welcome back to the Deep Dive. Today we're tackling a really significant piece of South African public health law, the Tobacco Products Control Act 83 of 1993.
That's right. It's a consolidated act, meaning it's been built upon over time.
And it's fascinating because it shows how legislation can reach into, well, almost every corner of life to tackle a health issue, from your car right up to global advertising.
Exactly. Our mission today is to really unpack this act, its legal structure, the key rules, and importantly, what it actually means in the real world. It's a fantastic case study in regulation.
So this wasn't just a one-off law in 93.
No, not at all. It was assented to in June 1993, kicked off in Feb 94. But the crucial thing is the consolidation. Major amendments came through, especially Act 12 of 1999, and then the really big ones in 2007 and 2008, Acts 23 and 63. Those really gave it the teeth we see today.
Okay, so let's start at the beginning. What was the main goal, the core purpose behind this whole thing?
Well, the objectives laid out are pretty clear. First, stop or limit smoking in public places. Second, get a tight grip on how tobacco products are sold and advertised. And third, set strict rules for the packaging itself.
Seems straightforward enough.
But the real power, I think, is in the preamble, the why. It explicitly states right up front that tobacco use is extremely injurious to health. And maybe even more importantly, it acknowledges it causes widespread addiction.
So it's not just rules for rules' sake. It's saying this stuff is dangerous and addictive, and that's why we're stepping in.
Precisely. It links the whole effort to the democratic values in the South African Constitution and also to international standards, like the WHO's Framework Convention on Tobacco Control. It's about protecting citizens' health rights.
And I noticed it calls out something specific about advertising right in the intro text.
Yes, that's really key. It points out that advertising often links tobacco with, being cool, successful in business, good at sports, that kind of thing.
Right, the lifestyle marketing.
Exactly. And the act says, look, this specific type of advertising is a big reason why children and young people start using tobacco. That insight really fuels the restrictions that follow.
Okay, so that sets the stage. Where does the act make its first sort of practical impact on daily life?
That would be Section 2, controlling where you can actually smoke. The main rule is pretty simple but sweeping.
Which is?
Section 2(1). No person may smoke a tobacco product in a public place. Period.
And how broad is public place? Because that can mean a lot of things.
Oh, it's very broad, and intentionally so. It covers basically any indoor, enclosed, or even partially enclosed area that's open to the public. Crucially, that includes your workplace.
Okay, workplaces too. What else?
And public conveyances. So think commercial flights, trains, buses, taxis, all covered.
It gets quite personal too, doesn't it? I remember reading something about cars.
It does. There's a specific ban.
Yeah.
You cannot smoke in a motor vehicle if there's a child under 12 present.
Makes sense.
And another interesting one, even a private dwelling, like someone's home, falls under the ban if it's being used commercially for childcare, schooling, or tutoring. So home-based creches or tutors, no smoking allowed during those activities.
Got it. Now, it's one thing to have a ban, but who actually have to make sure it's followed? Is it just up to the individual smoker?
No, the responsibility is placed firmly on the owner of the place or the person in control or the employer in a workplace. They have a positive duty to ensure no one smokes there.
How do they do that?
The Act mentions specific things, displaying the prescribed signs, the no smoking signs, and making prescribed public announcements.
Public announcements. That sounds a bit vague. How would, say, an office manager make a prescribed public announcement?
Yeah, that's a fair point. It's probably less common in practice than signage, but the intent is clear. Create an environment where non-smoking is the active norm. Maybe it means reminders in meetings or emails in a workplace context. It's about making the policy visible and known.
And what about employees? Do they have specific protections?
Absolutely. Section 2(5) is really strong on this. Employees have the right to object to smoking nearby without facing any kind of backlash or retaliation.
That's important.
Definitely. They also have the right not to be exposed to tobacco smoke at work. And maybe most powerfully, an employer cannot make working in a designated smoking area a condition of employment. You can't be forced into it.
Okay, so that covers where people can smoke and the responsibilities there. But what about the source, the industry itself? How does the act try to, limit their influence?
Right. This is where we shift to the really big restrictions on the tobacco companies. Section 3 is arguably the heart of the Act's strategy to prevent people, especially young people, from starting.
And what does Section 3 do?
It imposes a near-total ban on the advertising and promotion of tobacco products. It says you can't advertise or promote them through any direct or indirect means.
Any means. That sounds incredibly broad.
Right.
Does it mention specific things like sponsorships?
Oh, yes. It explicitly bans sponsorship of any organization, event, program, or even things like bursaries or scholarships. No linking tobacco brands to positive community activities.
Okay, let's nail down the language here because advertising can be slippery. How did the Act, especially with those later amendments, define it?
They define it very carefully to close loopholes. An advertisement includes any commercial communication intended to promote sales, but here's the really crucial part, especially thinking ahead.
Yeah.
It explicitly includes product placement.
Product placement, you mean like seeing a brand in a movie or TV show?
Exactly. The Act defines it as depicting or referencing a tobacco product or its brand element in broadcasts, films, or electronic media where the producer gets paid or gets some benefit for including it.
Wow, so this Consolidated Act from 2009 basically anticipated and banned paid influencer marketing or brand integration on screen long before it became such a huge thing online.
It seems incredibly prescient, doesn't it? They really were thinking about indirect promotion. They also define brand elements super broadly: slogans, logos, distinctive colors, anything that might make you think of a tobacco brand.
And promotion.
Promotion is defined as anything that fosters positive public attitudes, using incentives, organized activities, TV, radio, the internet, basically any public medium. The aim was to cut off all avenues for creating positive associations.
Okay, besides stopping the promotion, what about the actual sales? Age limit is obvious, I assume.
Yes, Section 4 sets a clear age limit. No selling or supplying tobacco products to anyone under 18, full stop.
Any other restrictions on what can be sold?
Yes, a couple of interesting ones. You can't sell or supply sweets, confectionery, or toys that look like or represent tobacco products.
Like those candy cigarettes.
Exactly those.
Yeah.
Banned. And location matters too. No sales allowed in health establishments, and that explicitly includes pharmacies.
Pharmacies too, okay.
And also no sales in places where under 18s are getting education or training, like schools or colleges.
Now, you mentioned the foresight regarding product placement. Is there anything similar for how things are sold?
Absolutely. And this might be the most forward-thinking provision of all, especially from the 2009 consolidation perspective. The Act bans selling or distributing tobacco products via postal services, the internet, or any other electronic media.
So, no online sales?
Yeah.
At all? Codified way back then?
Completely banned. Long before e-commerce dominated retail, it effectively outlawed any kind of remote sale where age verification is difficult or impossible.
That is remarkable foresight. What about giveaways or loyalty schemes?
Section 4A tackles that. No free distribution of tobacco products, no giving gifts, cash back, or entry into contests just for buying or using tobacco. You can't use rewards to encourage consumption.
And vending machines, are they just gone?
Tightly controlled under Section 5. They're only allowed in very specific public places designated by the minister. And crucially, the person in charge of the place has to ensure under 18s can't use them. So, the easily accessible machine on any street corner is a thing of the past.
Right. So we've covered where you can smoke, how products are advertised, how they're sold. What about the products themselves, the manufacturing?
Good point. The Act also steps into the factory, essentially. Section 3A deals with standards.
What kind of standards?
It mandates that no tobacco product can be manufactured or imported unless it meets prescribed standards. These cover things like the actual composition, the ingredients used, and importantly, the emissions, what comes out when it's smoked.
So the government can dictate what can and can't be in a cigarette or other product.
In principle, yes, through regulations based on this section. And linked to that is transparency. Manufacturers and importers must give information about the product and its emissions to the Minister of Health, and some of that info has to be made available to the public.
You have to tell people what's in it and what it produces. Makes sense. What about the packaging itself? Any rules there beyond just warnings?
Yes, Section 3, subsection 6 is key here. It bans packaging that is false, misleading, or deceptive, or anything likely to create a wrong impression about the health effects or risks.
Like calling something healthier.
Exactly. And crucially, it specifically prohibits using terms that create the impression one product is less harmful than another. Think words like light, mild, low tar. Those became illegal because they were seen as misleading consumers.
Okay. And how must retailers display these products?
There are rules for that too. Retailers have to display specific notices, health warnings, the minimum legal age sign in a certain way. And very practically, the products have to be kept where customers can't just pick them up and handle them before they've paid, usually behind the counter.
Limits impulse buys and casual handling, I guess.
That's the idea. And there's one more unusual rule in Section 3A about exports.
Exports. How does a South African law control exports?
Well, it says that products exported from South Africa must meet the health or product standards of the country they're being sent to. And if that destination country doesn't have any standards, then the South African Act's standards apply.
So South Africa won't allow itself to be used to dump substandard products on countries with weaker regulations.
That's the ethical stance embedded in the law. It's quite unique.
Okay, this is incredibly detailed. We've got rules for smokers, owners, sellers, advertisers, manufacturers. So what happens if someone breaks these rules?
Yeah.
Let's talk about the penalties in Section 7. What are the consequences?
The Act sets up a clear tiered system of fines depending on the offense. It starts relatively small.
For who?
For the individual smoker caught smoking in a prohibited public place, that carries a fine not exceeding R500.
Okay, R500 for lighting up where you shouldn't. What about the owner or employer who, say, doesn't put up the signs or allows smoking?
Their responsibility is higher. Failures like not displaying signs, not managing smoking areas properly, or violating employee rights, those carry a much larger maximum fine, up to R50,000.
Right, because that's a failure affecting potentially many people.
Exactly. Then we move up again for sales-related violations.
Like selling to kids.
Yes, selling to under 18s, selling those imitation sweets or toys, or violating the ban on internet or postal sales. Those offenses carry a maximum fine of R100,000.
Okay, R100K for illegal sales. Now, what about the really big stuff? The industry-level violations, like the advertising ban.
That's where the biggest hammer comes down. For anyone violating the core industry restrictions, the advertising and promotion ban in Section 3, the sponsorship ban, or failing to meet the manufacturing and packaging standards in Section 3A, or the rewards ban in 4A, the maximum fine jumps significantly.
How high?
Up to R1 million rand.
Wow. So the message is clear. Undermining the public health framework or promoting tobacco use is seen as the most serious offense by far.
Absolutely. It signals that systemic violations carry the heaviest legislative weight.
Looking back at everything we've covered, this act is it's so comprehensive. From personal behavior in a car to employee rights, banning sophisticated marketing like product placement, setting manufacturing standards, even influencing exports, it touches almost everything related to tobacco.
It really is remarkable in its scope, and particularly when you remember that the core of this very robust framework, including things like the online sales ban and the product placement ban, was consolidated and in place by 2009.
That foresight is the bit that really stands out. Banning sales via electronic media back then.
It's incredibly relevant for you, the listener, today, because even though this act was written primarily thinking about traditional cigarettes, the broad, carefully crafted definitions of terms like advertisement, promotion, brand element, and especially electronic media mean that this very same consolidated act provides a surprisingly strong legal foundation for regulating new nicotine and tobacco products.
You mean things like vaping products, e-cigarettes, or heat-not-burn devices?
Exactly. Even though those specific technologies weren't explicitly named back in 2009, the wide net cast by the Act's language gives regulators tools to potentially address their advertising, promotion, and online sales today. It makes you think about how well-drafted, forward-looking legislation can sometimes anticipate challenges that haven't even fully emerged yet. It connects this historic act directly to today's public health debates.